Good afternoon, everyone. My name is Crystal and this is Bronte, and we're medical students from Western Sydney University. We recently completed a year at our rural clinical school in Lismore, where we completed this project with the other students listed, Melina, Ashley, Taylor and Sarah, who aren't here today. So our project was about the use of mobile phone applications in helping people self-manage their type 2 diabetes. So we interviewed people living in rural and remote areas, and we interviewed both people who used apps and those who didn't use apps. In terms of an overview of what we'll be speaking about, we'll first give a background to the topic, then we'll discuss our methods and then the results, including barriers to app use, facilitators and useful features of the apps, recommendations for future practice, and a summary of factors influencing app use. Then we'll have some conclusions. So self-management of diabetes is considered an important factor in ensuring well-controlled blood sugar levels and preventing complications. Self-management strategies can include tracking blood sugar levels, adhering to medication regimes, monitoring nutrition, and participating in regular physical activity. Current research has demonstrated that apps are able to help facilitate these tasks, as well as improve people's attitudes and their confidence toward their self-management. Despite this, available apps have many shortfalls and limitations, which decrease their use in clinical practice. In particular, there is a lack of research surrounding the user's personal experience of app use for self-management, and we aim to address this gap and generate evidence-based recommendations to improve future apps in relation to consumer preferences and perceived useful features of the apps. So our study is the first study to use the 3 theoretical frameworks adapted from Anderson and colleagues in 2016 in relation to type 2 diabetes. And these 3 theoretical frameworks were used to develop a semi-structured interview guide, which when we interviewed the participants. So the first framework was the TAM, the Technology Acceptance Model, which measures how users accept technology and is based on the theory of reasoned action, that a person's intention to perform a behaviour is the main predictor about whether that behaviour will be performed. The perceived usefulness and ease of use influences people's attitudes and then influences their behavioural attention to use technology or their acceptance of technology, which then influences the actual use of the technology. The second framework is the HITAM, which is the Health Information Technology Acceptance Model, which furthers the concepts in the TAM, specifically to address health technology by incorporating the health belief model. And the health belief model suggests that belief in a personal threat, together with belief in the effectiveness of the proposed behaviour, predicts the likelihood of engaging in that behaviour. The third framework is the MARS, the Mobile Application Rating Scale, which is a 23-item rating scale focusing on the engagement, functionality, aesthetics, information, and subjective quality of the app. And these were used to develop our semi-structured interview guide. So this is the first study to focus on a rural Australian population where issues of access may increase the importance of self-management strategies. Studies have demonstrated that people living in rural or remote areas have higher rates of diabetes and experience worse health-related outcomes and higher death rates. Attributing factors include decreased health service access and diabetes testing and less effective self-management. So the primary aim of our study was to identify and understand perceptions of usefulness, experiences, barriers, and facilitators to mobile phone app use for the self-management of type 2 diabetes. A second aim was to determine reasons for non-app use or people who discontinued app use, why they stopped using them. Finally, we sought to acquire recommendations from both app users and non-app users about how the current apps could be improved to increase their usability. In terms of our methods, inclusion criteria for the participants required they were 18 years of age or older, resided in a remoteness area 2 or above, and had a diagnosis of type 2 diabetes for 6 months or more and owned a smartphone. Participants were recruited via flyers, which were distributed through GP and allied health practices, primarily in the Northern Rivers region of New South Wales, diabetes support groups and Facebook community forums, as well as the radio and snowballing techniques. Data were collected between September 2017 and February 2018, and the phone interviews were between 24 and 45 minutes long. And data were collected regarding a range of demographic features and features of the functions of the health apps that were available. Interviews were analysed using deductive content analysis using the program NVivo, and a structured analysis matrix was developed from the three theoretical frameworks, the MARS, TAM, and HITAM.
Okay, so moving on to the results. In total, we conducted 30 interviews with a fairly even split between app users and non-app users. We had ages ranged between 30 and 79 years, although to note that the most common age bracket was 60 to 69 years old, which is a little bit older. In terms of rurality, participants were from RA2 to RA4 with 18 participants from inner regional areas. And we had 10 different apps used by participants. And just to emphasise at this point, it didn't have to be a diabetes-specific app, but any app that would support a self-management task that related to diabetes. The most comprehensive apps that were used were Diabetes Journal and AccuCheck. So as Crystal mentioned, we analysed the themes in terms of barriers, facilitators, and recommendations from participants. In the barriers theme, we looked at things that were app-specific, which were barriers that were issues users had using apps which discourage them from further use, as well as user-specific, which were issues inherent to the user. So by far, the most common issue that came up were technological issues with the app. So the app failing to work as intended, not being user-friendly, and being difficult to navigate. To quote a participant, "I do have trouble setting up my phone to get apps because my internet service is not very strong here. To use my computer, I have to hotspot, and sometimes there's just no coverage. I think it's a lack of service." So that issue raised by that participant was quite specific to a rural population. There was also initial setup issues. So if the app wasn't Australian, the units of the insulin were difficult to use for the participants. The cost of the app was prohibitive for some people, and the font size made it difficult to navigate for others. So we've got a quote here from a participant that felt like because it was a medical issue, that cost shouldn't be a limiting factor for people. Moving on to user-specific barriers. We had perceptions of app use, so feeling that they didn't need to use an app, not knowing about available apps, and not having thought about using an app for diabetes management were barriers to use. Self-perception of diabetes was another theme that we explored. So this ties into the health belief model, where perceived threat affects intentions. So if the participants thought that the diabetes wasn't bad enough or that the current care was sufficient, they were less likely to use apps. And we have a quote here about a participant that describes not having discussed it with their GP before, which is a theme we further explore in facilitators. Unsurprisingly, there was also a large overlap between participants who had poor technological literacy and those that had negative attitudes towards technology, and a lot of participants attributed this to their older age. So looking at facilitators and useful features, in general, participants perceive the apps to be useful and improve their diabetes management, and most participants said that they would recommend their app to another person. So this, I think, demonstrates that apps do have the ability to improve self-management and perceptions of self-efficacy. So in terms of app-specific facilitators, if the app was user-friendly in terms of ease of navigation, clear design, or intuitive technology, participants were more likely to continue use. If the app was convenient in terms of able to export their data, so upload their blood sugars, and it be discreet and portable, participants were more likely to continue use. And we had a story from one participant who said when she was on her app at the restaurant recording her blood sugar levels, she just looked like everyone else on their phone at the restaurant. So that was really important for that user. But by far and away, the most common thing that came up was people were really interested in the visual representations of trends. So these were really highly valued and a significant reason for continued app use. And on further questioning, people said it was a source of motivation, but also allowed them to clearly link what they're eating in their diet and how their blood sugars were going. So we have a quote here about a participant that liked to see how they're going not on a day-to-day basis, but also monthly averages. An interesting user-specific facilitator that came up was interactions with healthcare professionals. So most participants had not received a recommendation from a healthcare professional, and those who were using apps, a lot of them hadn't actually mentioned it to a healthcare professional. However, those that did use it in conjunction with their GP tended to have really positive experiences, especially those apps that had the ability to export the data directly to health software. This was a facilitator for these discussions, and we have a quote here from a participant that talks about having their GP adding it directly to their file. And they said that discussing with a healthcare professional the use of the app encouraged self-reflection on home diabetes management. Other people said they would use an app if their GP were to recommend it. So moving on to the features that people thought would be useful in the apps in the future, a lot of people were interested in educational features, particularly education related to diabetes complications, so in particular hypoglycemic episodes as well as end organ damage. Others said they still prefer to get their information from other sources such as Google or GPs. In terms of customization features, again, it came back to this point of visual blood sugar level monitoring, with people saying that they wanted dynamic feedback in relation to how they're going with their trends on the app. Other people suggested additional self-management tasks or reminders, so these things included blood pressure monitoring, weight monitoring, activity tracking directly in the as well as recommendations for appointments. People noted that this was because diabetes wasn't the only condition that they were having to manage, and they had other comorbidities that were a health priority. In terms of nutritional features, people suggested carb calculators, diabetic-specific recipes, or meal suggestions. Most people weren't interested in medication reminders, however, thought that a medication list would be a useful feature. We asked directly if they thought that text messaging would be also useful in conjunction with feedback from the app in terms of the data inputted into the app. And most people thought that this would be really useful and thought that weekly would be a good amount of time to receive the text messages. So we've got a diagram here that really ties together the themes in terms of the health belief model. We've got individual perceptions, modifying factors affecting the likelihood of action. And I won't go through all these points again because I've just talked about them, but just to point out, as healthcare professionals, cues to action in terms of providing recommendations, as well as education on diabetes, are factors that can influence a person's decision. And then also from the other side, from app developers, maximising these perceived benefits of convenience and ease of uploading the blood sugar, and as well as minimising the barriers of the technological issues, can all act to increase utilisation of mobile phone applications. So looking at the strengths and limitations of our study, we used validated theoretical constructs that were well tested, which is a strength, as well as talking to individuals about their experiences, which is a previous gap in the literature. A limitation, however, is that we did use a self-selecting process, which could have self-selected individuals that were technologically literate, although we did have a fairly even split of app users and non-app users. We did focus on a rural population, however, this could probably be extrapolated to an urban setting as well. The other thing is we didn't get the perspective of healthcare professionals, and that would be useful in future studies. In conclusion, mobile phone applications can improve type 2 diabetes self-management, and this study is the first to qualitatively report on the attitudes and user experiences of rural Australians. These findings may help guide app developers and entrepreneurs in improving app design and usability. Given self-management is a significant factor in glycemic control, these findings are significant for healthcare professionals who may integrate apps into holistic management plans. And just a small acknowledgement, we'd just really like to acknowledge the participants who took their spare time to talk to us and our lovely supervisors from Lismore. Thank you. questions? Yep.
My name's Michael. I'm an intern in Orange.
Yep.
I was just wondering if you came across any hesitation from the users about privacy. Because there's been a lot of talk of privacy with my health record. And if I were a health insurer, I'd probably pay an app developer and bump up someone's premiums if their average BSL was higher than 12.
Yes.
Did you find that there are any issues that people had with that?
Yeah, so we actually directly asked about if people had privacy concerns, especially with data being uploaded to the cloud or the developer, and we didn't find that people had any concerns about that, despite the fact everyone seems concerned about my health records.
One participant particularly said to me, the data I'm uploading isn't particularly sensitive. Like, he didn't find it of a sensitive nature because to him they were just numbers, and he didn't find it to be personal information. So I think a few people held the belief that they weren't too concerned if others found out about what they were uploading.
Yes? We do.
Some of the most common ones that people used were AccuCheck, as well as MyFitnessPal. That was a common one as well, as was the Fitbit app. And people particularly liked that the Fitbit app linked in with MyFitnessPal, and they liked the integration of those. We do have a list
Yeah, those.
of all the apps.
Yeah, those 10 of them. Those Diabetes Journal as well, and BG Star, which doesn't exist anymore. Yeah, sorry, that's all I can remember. Yeah. Yeah. Thank you very much.
Thank you.